So let's take a look at this 33-year-old model now. She's got beautiful lip contour, good volumization and good ratio of the upper to the lower lip. Although she does say she wants a little bit more recontouring of the vermilion border on the upper, perhaps on the lateral aspect of the lower lip, and a little bit more volumization of the lateral tubercles on the upper lip. Perhaps the corners can also be slightly lifted upwards, and a little bit of filtral enhancement also. Okay, so straight ahead, and we start with a gentle smile with no leak. That's it. Go into a full smile with the teeth showing. That's it. Close your mouth gently, and then go into a pout. And relax. And then we turn this way. Start to go into a gentle smile, full toothy smile, and a pout. And relax. So we'll start off with the vermilion border using BELOTEROLips contour. So again, this is a 0.6 ml syringe, and we should be delivering retrograde threads from the top of the crest all the way down around 0.05 cc per thread. So we mark up the contour, length of the needle. We go immediately underneath the dermis. Here we are. There's no need to aspirate, but you can do if you fancy it. And we deliver around 0.03 to 0.05. Okay. Again, we reconnect that thread with the next thread. Open gently. Now augmenting the Cupid's bow. Again, we align it with the vermilion border to the top of the cusp and a retrograde thread, somewhere between 0.03 to 0.05 cc. 0.03, she doesn't need a lot. 0.03 per thread, and I did 2.5 threads. Okay. So having delivered the retrograde threads on the upper vermilion border and the Cupid's bow, we now move to the lower lip, where we start to recontour the vermilion border from the lateral aspect. Again, delivering a very slow retrograde thread of up to 0.05 cc per thread. And so now we're simply reconnecting those threads to create a continuous line of filler placement along the lower vermilion border. So sometimes patients may require a further strand or feather thread along the central portion of the lower lip, but it depends on the actual patient's vermilion projection. In this case, there's no need for a further central portion of the vermilion border enhancement. So, having just recontoured the vermilion border on the lower and the upper lip alongside the Cupid's bow, we can now start to evert, volumize and project the upper lip, particularly around the tubercle, around this zone here, with a bolus directed from the white lip into the red lip, and perhaps follow up with 2 further boluses, more lateral to that, around 0.05 cc for these lateral ones, and perhaps 0.1 cc for the central one. With regard to the lower lip, we want to enhance the 2 tubercles either side of the midline, so we want the bolus of 0.1 cc through here, and we direct the needle from the white lip into the red and place filler above the muscle. So the first Filler will be just under that depot there. First injection coming through. We aspirate. And we deliver something like 0.1 cc or perhaps less, depending on the look that the patient wants to achieve. So far that's 0.1 cc, so let's have a look. Don't forget to breathe.
So one more time.
Okay, so moving on a little bit more lateral now and delivering a bolus perhaps somewhere around here. We take the injection from the white body of the lip, we direct it above the muscle, underneath that injection point, aspirate, and again we deliver up to 0.05 cc for gentle augmentation. And withdraw. So now we move on to the lower lip to achieve a little bit more volumization and projection of the lower two tubercles through here. Again, the product will be delivered underneath this placement here. We enter from the white lip, direct our needle above the muscle, aspirate, and we can deliver up to 0.1 cc, depending on the desired look. So we move the injection a little more lateral, open gently. We should be placing the filler just around this point, again entering from the white lip, directing our needle above the muscle, aspirating and delivering around 0.05 cc of the BELOTEROLips shape. And our final bolus in the lower red lip, again entering from the white lip, aspirating and delivering up to 0.05 cc. Okay, so having finished the contour of the vermilion on the lower and the upper lip, we now move on to the corners of the lips. Gently open your mouth for me. This is using BELOTEROLips shape, and we extend the thread right through into the white lip along the vermilion border, and we deliver a retrograde thread of around 0.05 cc. Okay, close your mouth gently. Okay. So we now move into the philtral columns. The injection is a retrograde thread connecting the base of the nose to the cusp of the cupid's bow. So the injection goes in and it connects right through this nice curve of the philtral column. We aspirate and then we deliver a retrograde slow injection of around 0.05 cc of the BELOTEROLips shape. So having injected the vermilion border on the upper and the lower lip on the patient's left, as well as augmented the tubercle of the lower lip and the tubercle of the upper lip, lifted the corner up and augmented the philtrum, we can now move on to the other side to do the same treatments. So upon completion of both the upper and lower vermilion border, to enhance the contour of the lips, as well as enhance projection and volumization of the tubercles of the upper and the lower lip, inflecting the corners upwards, as well as enhancing the filtrums gently, we finished the lip augmentation with both 0.6 cc of BELOTEROLips shape and BELOTEROLips balance. So in total we've used 0.6 mils of BELOTEROLips contour for the contour of the lips, as well as the filter columns, coupled with 0.6 mils of BELOTEROLips shape for the projection and volumization of the red lip, as well as the inflection of the lip corners. So if we now have a look at the dynamic motions of the lips, if we go into a gentle pout and a gentle smile, and now a toothy smile for us, and back to normal. We can see that the fillers work beautifully with the lips in dynamic motion.